Hi, I'm Debu Tripathy, and I'm a medical oncologist at the University of Southern California, and I'm also editor-in-chief of Cure magazine. This is always an exciting time for us as we get together at ASCO and look at the latest information that's going to really affect our patients and how we practice medicine. One of the areas that I've been very fascinated about is targeted therapies, and the HER2/neu oncogene has been an example of a target that we can actually address with a variety of therapies and make a big difference. Patients with HER2-positive breast cancers now live longer than they had before, and this represents a paradigm in cancer that we would like to continue. So at this year's ASCO, there's a very important study looking at how we can continue to target the HER2 receptor, because what we're learning is that cancer cells are very intelligent. They have many different mutations that allow them to, sometimes 1 out of 1,000 cells can grow despite therapy and become resistant to treatment. So we're still having problems curing patients with advanced cancers. T-DM1 is a big step forward in that it is a drug that binds to cancer cells that express the HER2 protein. The other therapies that we have for HER2 breast cancer, like Herceptin, have been very effective, but ultimately patients with advanced cancer recur. And T-DM1 has now been tested in patients who have progressed on Herceptin, and it was compared to what we have always used in the past, which is a new drug called lapatinib in combination with a chemotherapy drug called capecitabine. This study is going to be presented at ASCO and is showing now that patients treated with T-DM1 actually do better than what the standard used to be. They have a significantly longer time before their cancer progresses. We don't know yet if they actually live longer. That information is still coming. So this is an important step forward in that it represents a new treatment for patients with HER2-positive breast cancer, but more importantly, it tells us that developing new therapies against the HER2 oncogene, which is driving these cancers, is going to continue to be important. So it gives us hope that even though T-DM1 may not be the final answer, it's not curing everybody, it is certainly slowing progression, but that with the notion that the target is still important, that we will be able to continue to develop other drugs against HER2. This is a very active area of research. But most importantly, for patients with HER2-positive breast cancer, we are hoping that this information will lead to the approval of this drug. It's a little too early to tell because the final data needs to be analyzed and reviewed by the Food and Drug Administration, but it will be yet another step forward. We're not going to get there in one giant step. It's going to take a lot of small steps, and at this meeting we have encountered another one of those small steps. So there's many other similar findings at ASCO, small incremental steps, but this one I think is an important one that will continue in the future.